Do you have ADHD? Are you a teenager? Maybe you are a parent of one. This topic is super important, but often nobody talks about it. Teens with ADHD can feel really confused about their bodies, relationships, and even their desires. It is tough, right? We need to understand how ADHD medication might affect your sexual health. Knowing these things can reduce so much anxiety. It helps you get the right support and just feel better overall. The pressure of ADHD symptoms, plus being a teenager, can cause a lot of worry and sadness. This can mess with how you see yourself and your close relationships. When you know the facts, you can speak up for yourself. You can find solutions that make you feel more stable and your relationships stronger. This discussion hits on something critical, yet often ignored, about growing up. ADHD is not just about not focusing or being too bouncy, it touches everything: your schoolwork, your friends, how you handle your feelings. These effects often start in childhood and stick around through your teen years and even into adulthood. It really shapes your whole life. And being a teenager, wow, that is a wild ride. Your brain is changing, your body is changing, hormones are everywhere. You naturally start getting curious about sex. This is a crucial time to figure out who you are attracted to, and what your boundaries are. But for young people with ADHD, this journey can be way more complicated. That impulsivity and trouble with emotions, a part of ADHD, can make you more likely to jump into risky sexual behaviors. Things like having many partners, not always using condoms, or having sex when you have been drinking or using drugs. Beyond just behaviors, ADHD can also make you more likely to experience sexual problems. What does sexual dysfunction even mean? It is just when you have ongoing trouble with desire, getting aroused, reaching orgasm, or even pain during sex. It is actually more common than most people think. It affects lots of adults and teens too. For guys, this might look like trouble getting or keeping an erection, or maybe finishing too fast. For girls, it could be pain during sex or just not feeling interested or aroused. When these issues pop up during your teen years, it can really hurt your feelings and self-esteem. It can set the stage for long-term problems with sexual satisfaction in relationships. So, getting help early is crucial. We recently did a really big study. We looked at data from over 600,000 teens who had ADHD. We found some key things about how different ADHD treatments affect sexual health, especially between guys and girls. We saw that specific medications, especially stimulants like Ritalin or Adderall, which many of you probably take, can really change sexual function. Understanding these findings is super important. It helps you, your family, and your doctor have better conversations. For teen guys taking stimulant medications, our research showed a clear link to increased libido. That means a higher sex drive. Some even showed hypersexual behaviors, which is like an unusually intense focus on sexual thoughts or activities. Plus, more guys on stimulants reported trouble getting erections. Think about it. A medicine helps you focus in class, but it might mess up your relationships. That is a huge thing to consider and manage. We think this happens because stimulants interact with brain chemicals like dopamine, which drives reward and desire. They might also tighten blood vessels, which you need for a healthy erection. Girls taking stimulant medications showed some similar patterns, but also some distinct ones. Girls on stimulants also reported higher sex drives and hypersexual behaviors. But here is an interesting twist. Girls on stimulants were also more likely to talk to their doctors about birth control. This might mean you are being smart and proactive about managing any increased sexual activity or risks. A really important finding for girls was that stimulant medications actually seem to reduce risky sexual behaviors. This is a noticeable difference from guys, where stimulants were linked to more risky behaviors. See, this gender difference means we need tailored advice about medication side effects and sexual health. You cannot just give the same advice to everyone. Now, what about non-stimulant ADHD medications? These include things like Intuniv, Tenex, Qelbree, and Strattera. For both guys and girls in our study, these generally had fewer sexual side effects. While no medication is totally risk-free and some people might still notice changes, their overall impact on sexual health was milder compared to the stimulants. For instance, girls on non-stimulants also used more birth control, but they did not show other big differences compared to their peers not taking medication. So, for some people, non-stimulant options might be a gentler choice for sexual health. This is likely because they work differently in the brain, often affecting other chemical pathways rather than just dopamine. Here is a reassuring bit from our study. We did not find any real link between ADHD or its treatments and unusual sexual interests. So you do not need to worry that ADHD meds might make someone develop those behaviors. This helps challenge old, unfair ideas that sometimes linked hypersexuality to certain groups. The main thing we learned is that the type of ADHD medication you take can have very different effects on your sexual health, and these effects really vary between teen guys and girls. This is not just an academic point. It is hugely important for doctors and patients. If you are a teen with ADHD or you are a parent, your healthcare provider must consider these potential sexual side effects when making a treatment plan. The goal is not just to help you focus, it is about supporting your entire well-being, and yes, that includes your sexual health. For doctors, these findings shout out for individualized care. For example, teen guys with ADHD, especially on stimulants, might need specific help with things like erectile problems or finishing too fast, alongside managing a strong sex drive. For girls, doctors might need to balance that increased libido and hypersexual behaviors with solid support for birth control choices and ways to reduce risks. It is absolutely vital to include routine sexual health checks in standard ADHD care. This means having open, honest conversations about these sensitive topics, even if it feels a little awkward or embarrassing at first. These discussions are normal and a key part of good healthcare. Your doctor should talk about these potential risks with you and your family beforehand. This helps you make informed choices that balance managing your ADHD with keeping your sexual health strong. It is also important to remember that ADHD often comes with other mental health conditions, things like anxiety, depression, or even borderline personality disorder. These other conditions can make diagnosing and treating ADHD even harder, and they can also affect your sexual behaviors and challenges on their own. For example, trouble with emotions or acting on impulse, common in both ADHD and borderline personality disorder, can make hypersexual or risky behaviors even stronger. So, your doctor needs to do a thorough check of all aspects of your mental and physical health. You should feel comfortable telling them everything without holding back. Here is a key principle. If you are taking a stimulant medication for ADHD and you notice any changes in your sexual desire, how your body responds sexually, or your sexual behaviors, you should definitely consider these as potential side effects from the medication. There are lots of treatment options out there, different types of meds, different doses. Talking openly and honestly with your doctor is your most powerful tool. This conversation helps them understand your full experience, not just your ADHD symptoms. It lets them adjust your treatment to make sure it helps both your brain function and your overall quality of life, explicitly including your sexual health. Ultimately, the goal for young people with ADHD is to help you succeed in every part of your life. To ignore sexual health, that is ignoring a basic part of being human and feeling good. Every patient deserves a treatment plan that manages their ADHD effectively and protects their sexual health and satisfaction. If any of this information resonates with you, or if you are noticing worrying changes in your sexual health, please talk to a trusted doctor or healthcare provider. They are equipped to handle these complex issues with understanding and expertise. They can help you figure out the best path forward for your unique medical needs. Your complete well-being is what truly matters in every single way.
This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. Get on-demand, concierge-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations associated with traditional medical visits. Take control of your health anytime, anywhere. Visit globalmenswellness.com to start your free trial today.